In 2007, FDA had the largest recall that they had ever experienced, and it started in March 15th, the Ides of March, and it was when Menu Foods had contacted FDA to tell them that they had a problem with one of their pet food lines. They had a fair number of cats on a taste test trial, and these cats developed kidney failure and died. And because they were confined, Menu Foods was able to trace back and identify that the food that was causing the problem had been made with a wheat gluten product that had come from a different supplier. So after this went public, CVM received many phone calls from veterinarians that had possible cases of the poisoning and from owners, and we were really swamped with calls. And so since the center is only about 400 people, I was asked to help with the pet food recall, and a lot of people were called in to work on the problem. I was asked to look at the pathology reports that were coming into the center and to interact with the veterinary pathologists that were contacting the center. And this was because I had previously, before coming to FDA, done research looking at kidney toxicology, and also I had taught pathology at the medical school. So after about 2 weeks of testing for all sorts of potential poisons that affect kidneys, the FDA Forensics Center found melamine in that suspect wheat gluten. Up until then, we all knew that the pet food was causing problems and was causing kidney failure in the animals, but nobody knew what was in the product itself. This was an interesting finding because we really didn't expect melamine to be found in pet food. Let me show you what melamine looks like. This is a six-membered ring with a lot of nitrogens in it. Melamine is used in plastics manufacture, and it really didn't make sense that it was in the wheat gluten or in the pet food. It's also used in Asia as a fertilizer, and in combination with cyanuric acid, it's a flame retardant. So because the Forensic Center had found melamine, I started doing a massive literature search on what melamine had shown in the past in toxicity studies. And in general, all the toxicologists pretty much said this can't be the thing causing the problem because melamine is only as toxic as table salt. So in other words, you'd have to eat, if you ate so much table salt that you would die, that's the same volume of melamine that you would have to eat, which would be quite a large amount. So I did this massive literature search, and I found an article in which they had looked at rats for 2 years. They had given them very large quantities of melamine, and over those 2-year periods, most of the rats survived pretty well, but they made bladder stones. And the authors of this study analyzed the bladder stones and found that they were melamine and uric acid, half and half. So I had found a link between melamine and some kind of urinary tract abnormality. The pathologists, in the meantime, were describing reports of crystals in the kidneys. And they mentioned that they weren't sure if the animals that were affected by the pet food recall were dying because of these crystals, but they definitely saw them in the tissues from those animals. They said they didn't see enough crystals to really cause kidney damage. And they also said these were very unique crystals and that they had never seen crystals like these before. April 3rd, some of the pathologists sent images to FDA of these crystals, and I'll show you what those look like. you can see that they're a golden brown color, and they have a radial pattern. There's very fine crystals in here, and they make this spherical structure, if you think of it in 3 dimensions. So when the pathologists saw these crystals, they said they had not seen any of these crystals before, nothing like these particular crystals. When I saw them, however, they reminded me of crystals that I had seen in human pathology. They looked to me like uric acid crystals. Humans with uric acid crystals in their joints will make these small tophi, these little yellow nodules in the joints. And if you take a little bit of fluid from the joint and you put it on a slide, you can see these needle-fine crystals of uric acid. And these crystals occasionally can form what we call spherulites. So they're these spherical structures that look very much like the crystals that we were seeing with the pet food recall. Another feature of these crystals is that if you take tissue from one of these nodules and you put it in formaldehyde, which is the routine preservative that's used to do histopathology, the crystals dissolve. And you can see here, this is the pathology from one of these nodules. And what you're seeing there are clefts in the tissue, but the crystals have actually dissolved out of the tissue. And all you see was where they were. I was wondering if the crystals that the pathologists were seeing had characteristics similar to the uric acid crystals that you find in humans. One other thing that I knew about was a syndrome in humans which is called uric acid nephropathy. When humans have derangements in their uric acid metabolism and get very elevated uric acid levels, they can produce spherulites like the ones you saw in the joint fluid, but they can precipitate in the kidneys and cause acute renal failure. And I have a schematic of that here. This is a nephron, which is the filtering unit of the kidney. And this little red area here is the glomerulus. That's the filter where the capillaries release some of the fluid that eventually makes the urine. So in this nephron, if you have very high levels of uric acid, you can have crystals form within this nephron in multiple areas, and you can get the entire flow obstructed from enough crystals. What happens then is that the tubules dilate because they're filling with this urine that can't pass, and the entire kidney actually swells against the capsule. This swelling then causes compression of the blood vessels, and without a blood supply to the kidney will fail. This is what I thought happened with the animals that had received the melamine contaminated pet food. If the melamine was combining with uric acid or another compound, for example, like the cyanuric acid that was in the flame retardant, I thought perhaps they were developing these crystals that we saw in the kidneys, and that the crystals were obstructing the flow of urine. I formulated a hypothesis, which I then submitted to the CVM management, saying that I thought that the melamine was involved, that it was combining with something and forming these crystals in the kidneys, and that the pathologists may not be seeing enough of these crystals because they were preserving the tissues in formaldehyde. Now, the hypothesis met with some skepticism. Since melamine in general is usually considered non-toxic, it was not widely accepted at first. So like any scientist that forms a hypothesis, I tried to go out and try to prove it. So I began to scour the pathology reports for tissues that maybe had not been preserved in formaldehyde. And I found one case report where the veterinarian had preserved some of the kidney in formaldehyde and sent it to the pathologist, but they had also put some of the kidney in the freezer. And I contacted the vet, and she sent me the kidney. and also the images that were from the histopathology. This is what the tissues looked like, and again, that cat had very similar crystals to those that I had seen previously in the other animals. And when I received the tissues from the veterinarian that were frozen, we did what we often do in fish diagnostics, is we did a wet mount. The wet mounts, you just take a very thin slice of the tissue and you put it on a slide, and then you just put another slide on top of it and compress the tissue. Then you look at this totally unfixed and unstained sample under the microscope. So what I saw was all these crystals. Looking at them at higher magnification, you can see that the crystals are all lined up in the tubules, and that there's actually debris at the upstream part of the tubule. And so you can see that it actually clogged up the tubule and wouldn't let the debris pass. And if you look at the higher magnification, you can see that these crystals look exactly like what the pathologists were seeing. So then I wanted to see if these crystals would dissolve with formaldehyde, and I took this section and I put it in a slide that has a little well, and I took a picture of it, and this was Friday afternoon, and you can see here that there are these crystals in here. I flooded it with formaldehyde and then came in on Monday morning, and you can see that the same area shows no crystals. There's a little bit of debris on the slide, so you can see that we are in exactly the same position, but there's no crystals on that slide. We also sent tissues from this animal to the forensic center, and they looked at these crystals with Raman spectroscopy and were able to identify the exact composition of the crystals. Here's the crystals, and they did a map with their lasers, and they got a spectrum, and that spectrum is identical to the spectrum if you mix melamine and cyanuric acid on a slide. So the spectrum was consistent with melamine cyanurate. So melamine was actually combining with cyanuric acid. This is cyanuric acid. And we now know that these compounds line up beautifully and produce hydrogen bonding, which you can see right here. And these interactions then make widespread sheets of these molecules of melamine and cyanuric acid combined. And those then eventually form the crystals. The crystals can form very, very rapidly. I have a little video that you can see here that shows melamine in solution, and drop by drop we're adding cyanuric acid. And as soon as you add the cyanuric acid, you can see the white crystals forming, and the precipitate is immediately formed upon dropping these solutions and mixing the solutions together. So we had figured out that the crystals were composed of melamine cyanurate, and we also saw that the crystals can form quite rapidly in vitro. And we felt we had a pretty good handle on what was causing the mortality in the dogs and cats, what was causing the kidney failure. So we had figured out what was going on with the pet food recall, and we thought that that story was over. And then a week later, we found out that not only had the pet food been contaminated with the wheat gluten, but that livestock feed, pig feed, chicken feed, and fish feed had all been contaminated with the melamine. Over 85,000 pigs had eaten this contaminated feed. Over 2.5 million chickens had eaten the feed, and many, many fish. So FDA was really concerned about the potential of a food safety problem. And we needed to figure out if these animals should enter the food supply, or if they'd be a risk if they entered the food supply. The first thing we needed was methods to detect melamine. Up until then, nobody really expected melamine to be in animal feeds. And so there had been no previous work done to look for melamine in animal flesh. So because my lab is normally poised to do these kinds of studies, we started within 2 weeks of finding out that the melamine was in fish feeds, we started dosing animals with melamine, with cyanuric acid, and with the combination of those two compounds. Now, how we did this was we would weigh out the chemicals and we would give fish the drugs in a tube and put those capsules that we had weighed out right down into their stomachs. So then we provided tissues to multiple centers around the country. We provided tissues to the Forensic Center, which was working on methods. We provided tissues to Denver's ORA laboratory and to CIFSAN. And all these chemists were working together and having conference calls. And within another few weeks, they had a method up online. So that was by the end of May, which is really lightning speed if you consider all that was accomplished during that time. We also looked at the kidneys of the fish that were exposed. And we did the wet mounts similar to what I showed you with the cat. And this is the result. The fish that were our control animals had normal appearing kidneys. You can see the glomeruli are these little red capillary tufts, and these kidneys have no crystals in them. The fish that were given melamine alone and cyanuric acid alone also had this general appearance. The fish that received melamine and cyanuric acid together formed massive numbers of crystals. So in addition to developing new methods, we also were able to show without a doubt that when you give an animal melamine and cyanuric acid together, they form these crystals. And the crystals in the fish looked just like the crystals that we were seeing in the dogs and the cats from the pet food recall. So we thought at that point that the story was over and melamine is not going to be added into any more food products. And then September 11th, 2008, we found out that melamine was present in infant formula in China. The reports were that Chinese babies had been found with high levels of kidney stones. And it's very unusual for babies to get kidney stones. And the pediatricians worried about it and complained, and people started analyzing what these kids were eating. And lo and behold, they found melamine in the infant formula. The children were not developing kidney failure per se, except the ones that actually had stones that would get stuck in the ureters. And the children then wouldn't be able to pass any urine, and then they would go into kidney failure. So the contaminant that was in the infant formula was melamine alone. And what the children were making were melamine uric acid stones. So these were very similar to what I had found out in that first article where the rats had been fed melamine for 2 years, and they made melamine uric acid stones that ended up in their bladders. Let me show you the difference between the crystals that we saw in the pet foods and the melamine uric acid stones that were found in the children. The stones in the infants, this is one stone that is about the size of my pinky finger, and this is a millimeter here. The crystals compared to the stone are very, very, very tiny. And when you magnify them, you can see that just in that little spot, there are about 50 crystals. So the crystals are very tiny and they're located inside the kidney. The stones were formed within the kidney, but some of them passed out of the kidneys into the ureters, and they're much, much larger. The babies that died from the stones died because the stones got stuck and obstructed the flow of urine, and without being able to pass urine, those babies died. So the infants that formed these stones had been on infant formula for quite a long time, and we don't know how long it takes for the stones to develop. But the infant that I showed you, the stone, was born in November 2007, and she had been on formula for quite a while before the stone was diagnosed. We didn't realize it at the time, but in 2007, some Chinese producers were adding melamine to poor quality products. They were taking melamine, putting it into wheat flour, and then selling it as wheat gluten, which has a higher protein content. Because melamine has the high nitrogen, and the tests for protein routinely just test for the nitrogen level, they were able to fake the tests and look like their products had a lot of protein, which sells at a higher price. This wheat gluten then was imported into the United States. It was used by multiple pet food companies to make their pet foods, and then eventually it caused the toxicity in the animals. It also was in the livestock feeds, in fish feeds, in pig feeds, and chicken feeds. And as far as we know, it didn't cause mortalities there, but it was present in levels that could be detected in the food itself.